So hi everyone, welcome to our June Huddle. I'm really excited to introduce our guest speaker today, and the reason I am is because if you've ever heard me give talks about diabetes and stress, one of the things that I say is that in all of Canada, there is only 3 psychologists or counselors who have an expertise in diabetes. One is Michael Van. The second one is Michelle Sorensen in Ottawa, and the third one is me at UBC or in Vancouver. And now I met Lauren, number 4. So that is really exciting to finally have another person who has an expertise. But more than that, Lauren has it. So she is even better in the sense that she knows exactly how you're feeling, the stressors and frustrations you go through. So before I actually introduce her formally, I just want to talk about the description of the session so we're all on the same page. The format of the session is going to be similar to all the other sessions we've had online. We'll start off by answering the questions that you all had submitted ahead of time. And then the latter half, we'll do kind of a free-for-all, question answer in real time. And the best way to do that is you can just raise your hand. I'll see your hand, and then I'll just have you go ahead and ask your question. So I'm going to read the questions that were submitted ahead of time, and Lauren's going to respond. If you're the person who submitted that question, feel free to unmute and ask follow-up questions or engage in a conversation with Lauren. I want to remind everyone that we are recording this event, so folks who weren't able to participate tonight can actually access this session on T1D Huddle. So I also want to remind everyone, just to make sure that there's a lot of clarity in what we're hearing, that if you're not talking, if you can mute yourself, and as soon as you talk, just unmute, and that way we're not going to hear any interference. All right, and if we need to, if you're not unmuted and we need to mute you, Soraya is going to do so, and don't take it personally at all. All right, so to make sure the session runs smoothly, I just have 3 ground rules. The first one is only one person talks at a time. The second one is if the discussion does go a little bit longer and it's kind of maybe one conversation is monopolizing the time, then I'm going to give kind of the signal and give you about 10 seconds to wrap up. I just want to make sure everyone gets their questions in. And number 3 is just to be respectful of one another. No interrupting. If you have something to say, happy to have you say it. Just raise your hand. I'll write it down on my sheet and call you right afterwards. So no need. All right, now I get to introduce Lauren. Lauren has lived with type 1 for 32 years. A life-changing experience with a counselor in her mid-20s not only reduced her diabetes distress, but also helped Lauren see type 1 in a positive light. After working for 15 years in the mental health field, Lauren recently obtained her Master's of Counseling degree from the University of Calgary. She lives in Kimberley, BC, and loves exploring the local trails with her husband and 2 daughters. Currently, Lauren works as a mental health clinician for the Ministry of Child and Family Development. The emotion-focused mindfulness and compassion-based approach that Lauren uses with clients parallels the tools she personally uses to manage her own mental health. And like the T1D Huddle community, Lauren is passionate about nurturing connections. She recently ran a counseling group for youth with T1D and has spoken at other T1D events. So without further ado, Lauren, would you like to just introduce yourself in your own words, and then we can start with the questions?
Sure. Hi, everybody. Thank you. Thank you for that introduction. I'm just really passionate about speaking on this topic tonight because I feel like so much of diabetes care is focused on the behavioral, and in my opinion, if we're not talking about the emotional aspects of type 1, then I feel like we're missing out on a big component of how to make that behavioral piece easier. So I'll be sharing a lot of my own kind of perspectives and thoughts on things tonight, and just invite you to, it's not this isn't the only way to think about it, but I hope that it just inspires you to reflect on how you might see it differently, or how you might be experiencing it. And I feel like that's what I like about these kind of conversations.
Okay, let's go ahead and start with the pre-submitted questions. Number one, have there been any studies that look at the practice of mindfulness and diabetes?
Okay, so it's yes, that's kind of the easy piece. And before I get into the research on it, the broad definition of mindfulness is, mindfulness is defined as essentially our ability to pay attention to something, an emotion or an event, without any judgment, and just really kind of having that curiosity, or that curiosity and non-judgment about something. So I think when it comes to diabetes, a lot of the mindfulness research has looked at kind of what is that inner voice, or what are the thoughts in our head that are labeling events that we go through day in and day out. When you see a 13.2 on your blood, on your screen, or how do you label that? And I think the mindfulness piece is, it gives us a chance to pay attention to what we're going through. And so a lot of the research, or fairly new research, has looked at mindfulness and self-compassion as a way to, as something that is linked to this diabetes distress that we're kind of talking about through the Huddle quite a bit. So researchers have documented that when people are experiencing a lot of diabetes distress, they tend to not be very mindful of what their emotional experience is attached to it, and they don't have a lot of self-compassion towards their own experiences. And so that piece, that kind of not being compassionate and not being kind of, curious around, or kind of aware of what your emotions are. I hope that that's what we kind of speak to tonight quite a bit, and kind of get an understanding of that, because the results of those studies say, and I'll read it out, that when the ways in which people with type 1 regulate their diabetes related emotions, that has a direct impact on their experience of diabetes distress. So self-compassion is something that you'll hear me talk about a lot. In the research on mindfulness, self-compassion is a concept that is brought up quite a bit. And there's kind of 3 areas of self-compassion, and mindfulness is one of them, that non-judgmental lens that we can bring to something. The other parts of self-compassion are just that kindness, like those kind messages that we give ourselves when things aren't going how we want them to. And also kind of the reason why there's this number of people on the call, just the common humanity, or the fact that this is hard and we all get that, and that it's a shared experience. So those elements of self-compassion are something that I'll be speaking to throughout tonight.
Okay. The person who asked that question, I have it on as anonymous. Would you like to follow up? Happy to have you follow up if you want to reveal yourself. Okay, great. I'll go to the next question. How can someone newly diagnosed come to accept diabetes?
So when I first saw that question, it feels like a really big one, because I feel that if anyone has an answer on how to do that by like a flick of a switch, then I would love, please speak up at the end of this, but I'll share my piece, because I think that whole acceptance piece is kind of a journey. For me, it's been a journey, and I feel that I am at times accepting myself and parts of my diabetes, and sort of most of the time I'm just moving towards that feeling more accepting of it. So I think how I personally have got to becoming more accepting is through self-compassion, through kind of sitting and honoring the emotions that I'm feeling about diabetes at any given moment, or big ones that keep coming back again and again, and being mindful to those. So one of the things that I've done with people that have type 1, and I've gone through this process myself, is that I kind of give a voice to the part of me that is feeling like I am having a hard time accepting diabetes. And so sometimes and you'll hear me talk about this tonight, I'm so used to doing it that I was just thinking about how to share it with you, that I almost externalize those parts of myself, or I put them outside of me. It's almost like I can put them in a chair so I can sit next to them. And that sitting next to that part of me that's having a hard time accepting, that's what I've had the most success with. And I've seen other people just kind of settle into it, because all of a sudden that person, that part of me, feels heard. They feel understood. They, I can ask them, like, what am I not understanding? What are other people not understanding about your experience with type 1? What do people not get? What do you wish people would say to you that they're not saying? What is it going to take to you feel like you're kind of moving towards accepting all this a bit more? And I think, those innate, sorry, my sensor is going off, and I know you would all know that. You should probably just look. Hi. And so I think, just being able to honor that person, that part of you, and to be able to sit with the emotion that they're having at any given moment. That's been part of my journey of acceptance and kind of getting more accepting, is checking in on that. I think it's a first step. I think it's something that when I say that, some people might just be, what do you mean parts of myself? That doesn't make sense to me. And so that's how I view it, but maybe other people might view it just as an emotion or a sense of feeling frustrated. However, those emotions kind of can feel seen and heard. I think that's helping them feel accepted.
The person who asked that question is also anonymous. Would you like to follow up and unmute? Okay, Lauren, I actually have a follow-up question. So you diagnosed, or you've lived with diabetes for 32 years. How long did it take before you feel like you truly accepted it? Like how many years in? Because I know a lot of folks here have had diabetes for up to 50 years, and some people just got diagnosed in the last year. And so, I know that every person is unique, but it'd be great to know, kind of in your journey, when do you feel like the light switch, that some light switch turned on?
Yep. So the moment that that you mentioned in that introduction, I was diagnosed when I was 7, and until I was kind of the early 20s, I had the kindest, most helpful team around me, and you know the team, and I couldn't accept diabetes. I was kind of in denial. I didn't take blood tests. I didn't take insulin for a little bit when I was a kid. I fed it to my parents checked my needles, and then I pushed the insulin into a plant in my parents' house that is still growing quite well. And so for me, it was when and we'll talk about this a little bit later. I know there's a question around trauma, but for me, I went to a counselor, and she had that kind of inkling that this was kind of traumatic for you, that moment that you were diagnosed, that something big happened there for you. And I had never really thought of that. It was like I was diagnosed, and I just kind of went sunk right into these are all the things I need to do, and I'm having a hard time doing them. But with a counselor, when I sat and she helped me kind of access those memories through something called eye movement desensitization reprocessing, but it's EMDR is like one way that you can work with emotions, but there's lots of other ways. EMDR for me helped me realize, like, I had so much sadness and shame and guilt around that diagnosis memory. Like, I almost had stabbing pains in these two parts of my body when I was to tell that story for the first time. And when I was able to recognize and process that sense that I felt broken, that's when, for me, that was the shift to actually being more accepting of it, was I had to process those emotions first, because I couldn't pinpoint it. I didn't know with words that was happening, but it was in my body. And that was a turning point for me.
Okay, great. The next question comes from Nikki. Hi, Nikki. Do you have any tips on helping to stay positive and mentally adjusting to having devices attached to you all the time? I'm 9 months diagnosed on a CGM now, also a pump. It's a lot. Changing them all the time, getting used to having something foreign on your body, the frustration it can cause when something fails, so many different factors. Any insight would be helpful.
Mm-hmm. And yeah, these are all such great questions. I think that it's almost a little bit backwards or odd the way I'll answer this, but I think I was able to become more positive and feel that I was, adjusting to devices on my body when I stopped trying so hard to be negative about it. I think we have so many shoulds. Like, you should be positive about this. I should be able to get over it. And so I think when I dropped that word should around anything about my diabetes, that's kind of when I started feeling better. I think it's such a big ask. It's a big ask of ourselves. It's a big ask of other people, whether, it's a family member or someone kind of in a clinic trying to support us, but it's a big ask to be positive. And so I wanted to first just highlight that in your question. And that for me, it's come through all these things that we're talking about. I had to become really aware and mindful of how sad I was, how sad I still am at times, how much shame I have around blood sugars not being perfect, how much embarrassment or sadness I think around putting on a device and kind of comparing myself to other people. I do that a lot. And so again, I think this is a journey. I don't think there's an easy answer to your question, but I think for me the answer was to kind of sit with whatever I was feeling in the moment and almost taking the charge out of those things. So if I tried to just be positive about it, I couldn't, because there was some sadness there, and there still is. And so sitting with those things has helped me become more positive. I think another part of it is that because I do that thing where I kind of put those parts of me in a chair and I kind of imagine talking to them, I think over time, I find myself like a lot more grateful for that person. I feel grateful for diabetes. I'm grateful that it's making me have all these kind of healthier choices than maybe I wouldn't have if I didn't have type 1. So I think the staying positive and adjusting piece partly has to do with sitting with those hard emotions. And when I say that, sometimes when you hear the word mindfulness, or you hear the word mindfulness or self-compassion, sometimes there's those posters that I see that are, you know, someone sitting on a beach and they're very zen-like, and they're enjoying their moments of mindful, you know, attention to their breath. And I think when you're seeing it kind of in this light, or the way I'm talking about it, sometimes it's not so comfortable. Sometimes it's really hard to be mindful of those things. So that's one part of it, is that sitting with those things to take the charge out of them, which over time for me has made things feel lighter and easier in how I navigate diabetes. Are we okay on time? Is that?
Nikki, did you want to unmute and follow up?
Okay, here we go. Sorry. Thank you for that. I feel like I'm in general a pretty positive person, and it's been a struggle. More like when the devices cause issues, which I find is a lot. And say if it like is hurting me, or I'll get errors a lot, or just adjusting to something on my body in general. Because before diabetes, like I don't really like a lot of things in general, like on me. So, but I think, you answered it well. Just, I'm seeing a counselor as well, so that does help. And thank you very much.
I have a funny story. My friend, when I first got a CGM a while ago, or years ago, she duct taped a Game Boy to her stomach and tried to make me feel better about going it. And it's like some things can be helpful, and then sometimes people just, you know, other people, it's hard for them to understand what it's like to have something on us all day. Like it.
It's mostly the sleeping part that's hard for me, because I move around a lot, and I think that causes a lot of, like, it'll hurt if I have it a certain place and I'll wake up, or that'll cause errors or something, and it can just get really tiring.
Mm-hmm. Well, I hear you. I just, like, for so many things, I just wish there was like a magic wand that, you know, we all had the magic answers for each other. But
at the same time, we're blessed that the technology is here, and I'm trying to turn it around always, and just be like, look at it more in that light.
Which I think, like, and that's not an easy feat to do that. And so I think that, and it's almost like we have to do that 10 times more than we're having the other thoughts. Like it takes a lot of those positive thoughts for me to be able to feel like it's making a difference. So I think over time, those positive thoughts on how you're, like, I think they just kind of stick in, they do make a difference, but it does take time, I think.
Yeah, thank you.
Okay, great. Next question is from Patricia. Do you find that almost all moods, stresses, excitements, major worries, etc. affect your blood sugars, most often sending your blood sugar up, and only a few bring it down? How do you handle that?
I feel like everything affects your blood sugar, including all these moods. And so I felt like I wasn't gonna have I'm still trying to think about how I'm gonna answer this one. Yes, I've had that experience where it's almost frustrating, because when I'm feeling stressed one day, my blood sugars can kind of be stable, when the next day I'm feeling stressed and they're not. So I think for me, the biggest part of understanding kind of all these factors and all these moods, I thought I could share a little bit about the emotional side of it, in terms of something to check out is the Heart Math Institute. They have a lot of movies, videos, kind of the science behind heart math. Heart math was something that really helped me kind of get good insight into how my moods are impacting my blood sugars. So I'll try to give you the 30-second overview of heart math, but heart math is all about kind of getting out of our head and into our heart. Heart math believes that our heart is a lot more than something that pumps blood out, that there's actually a lot of its ability to help manage all the, on a cellular level, everything that's going on in our body is pretty powerful. And so what heart math has to say about moods is that we can impact our how our insulin is working in our body by looking at kind of trying to insert thoughts when we're thinking about something joyful, or we are thinking about something that we are grateful for. Heart math. It's heart math, as in the subject in school. When we think about something joyful or something that we are grateful for, and we don't just think about it, but we actually kind of get out of our head and we sink down into how it feels, our my blood sugars, this is my experience with it, tend to drop. Like they tend to even out. And when we're frustrated and we're angry, all their research shows that kind of the ability for, on a cellular level, to have this kind of balance and all the organs kind of working together, it's not there when we're feeling angry, frustrated, and all those, negative emotions. So I would check out heart math. I think that kind of puts it's an interesting way to look at emotions and mood and kind of management of something like type 1, where there's so many unknowns in type 1. So I wanted to share a little bit about heart math.
Philip, do you want to unmute and follow up? Okay, number 5. Can mood swings be attributed to diabetes, and what techniques can we practice to control them?
Okay. So, because I, on a daily basis, I work a lot with children and families, and so kind of given my emotion kind of focused lens on things, I kind of see something very behavioral in a mood swing. So if I was, if I am acting defensive, or if I am acting kind of like I'm in a low mood, I get really curious as to what's under that, what's fueling that mood that I'm having in that moment. And so often when we're talking about a mood swing, sometimes we're thinking about like what other people are seeing in us, or kind of what we're feeling kind of in that state. Like, no wonder people with type 1 have a lot of mood swings, because we have so many things going on and we have so many things to manage. We're trying to manage what an organ usually does. And so there's not a direct, or not to my knowledge, kind of this direct connection between diabetes causes mood swings, but I think there's more, to me, it's more of a no wonder someone with diabetes who's trying to manage blood sugars is going to experience kind of swings in their mood. And if we're trying to support that in either ourselves or someone else, again, I'll come back to what's fueling the mood. What am I feeling frustrated right now? Am I scared about having these blood sugars be high for, what feels like a long time and I'm having or am I frustrated at a device that I'm waking up in the morning and it's hurting and my sleep is wrecking it. And so I think I just get curious at what the behaviors are that someone else we're seeing in any given mood, and to kind of go back to that emotional piece and to be really kind to ourselves that we're experiencing that in the moment, and that's okay. Sometimes I think detaching ourselves a little bit, and again, just getting curious to what you're experiencing is build self-awareness. And really that's kind of a big kind of takeaway, I think, for myself tonight was diabetes requires that we are constantly being mindful of what's going on inside, and that relates and is the same thing for kind of having a mood swing, I think. I hope I answered that one. I feel like that was a little bit roundabout.
The person, I know it's anonymous, but the person okay. Did the person who asked that question want to unmute and follow up? Okay, next question is from Stuart. I noticed that when I'm stressed, my blood sugars rise and stay high despite extra insulin. What is the relationship between stress and blood sugars, and what are the processes that can cause this?
Yeah, so there's a lot of different, that's a really kind of, it's a complex question because there's a lot of things that stress-wise are at play in any given moment. And so I think the easiest way that I usually think about it is when I am experiencing stress, my body becomes more resistant to insulin. And so and that can be kind of a short-term resistance. And if we're experiencing stress over time, then that kind of resistance is there, throughout the day and throughout the weeks, and kind of is always impacting how our body uses insulin. I'll share this story because I went and did a yoga training once. I never wanted to become a yoga teacher, but I had 3 weeks that I had to take off work. So I went down to Baja, Mexico, and I sat on a beach for 3 weeks and did yoga meditated and just had zero stress because we were eating out of a garden. So there's all these types of stress that were taken out of my life, and my insulin needs went down like 40-50%. And so I think it's just, for me, I always remember that stress, it's hard, we're not hooked up to all the different types of kind of lab kind of monitors and feedback loops that you would be getting kind of in like a science lab, or to kind of give you feedback on how much stress is how much you're experiencing. So it's hard to quantify it, but knowing that the cortisol in your body, elevated cortisol can cause that resistance to insulin. And so I think that's why a lot of the research speaks to meditating and doing yoga and going out for walks and kind of paying attention to your breath. All those things have been shown to decrease our experiences of stress and then help the body kind of get back that ability to use insulin effectively in our body.
Stuart, did you want to follow up? Oh, yeah, Stuart, go ahead. You need to unmute if you want to follow up. I can see you wanting. There you go.
Okay, so you mentioned cortisol. Can you talk a bit more about that, how it works in us?
Yeah, I feel, and this is like, these are things that one second, I'll just make sure that I'm speaking to what I'm just trying to get my blood sugar that's dropping quickly for me. 1 second. I also want to see if I have this. I had a study on stress and cortisol that I wanted to read out to you, but I'm not finding it. So I think in terms of cortisol, this isn't something that I've personally researched a lot. It's more for me the mindfulness piece around knowing that my blood sugars tend to go down when I do things that are said to reduce those kind of stress hormones in our body. And so cortisol is kind of made by the adrenal glands that when we're feeling stressed, cortisol is released in our body because it is sort of helping our body respond to stress. Glucagon level or glycogen levels also go up in our body. So all these things that we're trying not to have happen, or we're trying not to have influence our blood glucose level and our the insulin that we are taking, they kind of butt heads, if that's a good way to explain it, and that the cortisol makes the insulin that you're taking less effective.
Okay, so Stuart, I'm going to follow up with that. So you know that expression fight or flight? So when you get in that mode of fight or flight, your body doesn't know whether the stress is just the coworker being annoying or it's a bear, right? So then what your body does is it releases cortisol, so you have, your blood sugar goes up, so you have all the energy you need to fight or flight. So I think and it continues until it feels the stressor is going to go away. So I think your body's trying to help you, but it's actually hurting you if you have type 1.
And I'll build on that just a bit. So there's an interesting TED Talk by Kelly McConkie, which is Stress is Your Friend, or something along those lines. That's what I was trying to find the piece of paper on. Befriending Stress. Stress is also kind of our body's response to all those kind of cortisol levels and other things that are going on is influenced by our perception of it. And so when an event, two people could be going through the same event, but if someone doesn't perceive it as stressful, or you use these mindfulness techniques to notice that you're feeling stressed and try to just tell yourself, it's okay that I'm stressed right now, and things are going to be okay, this is going to pass, that we do have some control over our body's response to a stress or a stressor by the way that we talk to ourselves and by the way that we perceive it. So Kelly's TED Talk is she talks a lot about the research around how she studied people's perceptions or lenses on stress.
Okay, great. Next question is from Michael. How do I deal with anxiety around the potential for my daughter to get a future diagnosis? I would feel fully responsible for all the pain and suffering she would have to live with.
So when I read that question, I can relate to the person that asked. It's hard when you have kids to think about what and if might happen. Whenever my daughter asks for a third glass of water at dinner, I don't know, I'd say 2 out of 10 times I'll go and I'll test her blood to make sure it's not high. So I get that concern for you. I think what stands out for me in that question is kind of the weight of it, and just how much worry there is that you would be influencing this pain and suffering on her. And so one question that just kind of came to mind was, how would it be different if it didn't feel like diabetes was painful and if you were suffering. And I think, I go back to that, the ability to talk to the parts of ourselves that are feeling that. What is that part of you worried about? What if your daughter did get diabetes? And I get curious around that. I'd sit with it and just kind of explore why that is so worrisome. And then also the self-compassion piece for myself when I have those thoughts about my kids, I come back to the same thought over and over again. If they get diabetes, then I am the perfect person to be able to be supporting them through that. And that's a hard thing to think about for me. And I also trust that if and when that happens, I'm going to kind of have these tools to be able to work through it myself. And that, that I am that perfect person to be able to support them through it. And so that's the thought and the kind of, words or hug that I give myself every time I do think about my kids and type 1 and hoping that, what is that thought that might help you kind of feel like it's honoring that it's there, honoring that you're having that worry, and that's completely understandable. I get it. And what's that kind of, what would it be like to be kind of compassionate to it, and how could that help?
Michael, did you want to follow up? Okay. Next question is from Kent. How do we revert through past trauma and habits from diabetes to start making new, better decisions for our care, starting over?
When I hear the word trauma, like I think of kind of the definition of a traumatic event is a distressing event that kind of affects our ability to cope, and that that the person is having a hard time integrating the emotions that are related to that event. So I think everything that we've talked about tonight is, one, you can't integrate emotions if you're not aware of them, in some respects. So I think for me, one, acknowledging that, being diagnosed is a moment in kind of our lives that was distressing. And I think of the movie Inside Out when we think about when something happens to us, how our body, I hope other people have seen Inside Out, where the character is kind of having all these emotions, kind of processing all the events of their lives. That for me, being able to work with a counselor I said this before, processing the sadness, shame, feelings that I was broken and that something was wrong with me. Those are the things I had to work through so that I wasn't carrying around the heaviness, I guess I would call it heaviness, of that memory, of that time in my life where I was so confused. More recently, I've been working with a different counselor. I think I go to a lot of different counselors over my life just because I feel like each one of them adds to this journey of kind of untying knots and kind of unraveling the story for me around diabetes. And she had me go back to kind of that moment, those moments when I was like an 8, 9, 10-year-old in an endo appointment, and I had stayed up the night before until 2 o'clock, 3 o'clock in the morning, writing out weeks of blood sugars. I had 7 different pens. Like, I'd lie about it because I felt like I had to show up with all these perfect records. And so the ability to go back and imagine, who did I need to be with me in that moment? Who did I need to be sitting with me in those appointments when all I was wanting was kind of a hug? And so I think counselors, psychologists are really are quite aware that whatever your story is around being diagnosed, adjusting to this, continuing to live with it, that story is something that you can kind of, again, integrate those emotions kind of through self-awareness, and make those, if there are any distressing elements of it, again, taking the charge out of it.
Okay, Kent, do you want to unmute and follow up? Because you actually do have another question, and I'd be happy for you to ask it in your own voice.
Okay, thank you very much for your answers on that. It's sorry I missed the first of the call too, but I was trying to get my computer going. But I relate to things you're saying already, even though I didn't hear your introduction and stuff. I've been diabetic 38 years, so I got it 9 years old. And I think my best thing that I've had is, and as people are saying in the comments, is talking to other diabetics and in groups like this is one of the best things. I haven't seen counselors myself about diabetes so much, but when I was in a course a couple of years ago, I had identified while I was working as kind of like as a counselor support worker in a treatment program, because I went through alcoholism and addiction and things for 20 years, 11 years clean and sober now. But Dr. Gabor Mate had identified to me that I was suffering from trauma. I used to compare my trauma to they basically went through, I said it in the last meeting I was on, but they went through a whole group of people in a native treatment center that talked about they had been to residential school and they had been abused there by priests, and I'm going to kind of generalize a little bit by priests and nuns and this and that. Then there was people that talked that not taking away from, but they're talking about being molested through years of their life. There's other people talked about being raped, people being physically abused, stuff like that. I was the last person to talk, and I was like, and I did this for a long time, my addiction with my diabetes. I'd sit there and say, I'd listen to these people, and I'd sit there thinking, with my alcoholism and addiction, I'd think, oh, well, I got no excuse. I don't have these people's trauma. And Dr. Gabor Mate said, and I told him directly that, and to everyone, he said, here's the problem, is you're comparing your trauma to other people's. Your trauma is your own, right? So, for it to have such a, top doctor like him go and recognize it, and it brought a lot out for me. I haven't dealt with it a lot since, but, and it doesn't necessarily compare the same to those things, but diabetes is like a trauma that it can happen every day, and you got to learn to deal with that trauma. I mean, I still have my days that, it's funny, I heard you talking about going to an endocrinologist and changing blood sugars. I've done that before. I remember doing that because, everyone's saying, well, you got to get your blood sugars under control and things like, losing your license and stuff like that, which I did. But, so, I really appreciate hearing from you and hearing from other people in comments. My next question, I think I state things so well on paper, but is, what methods do you use to assertively deal with people who do not know about diabetes, but try to tell us how to manage it? Sometimes it's hard to just cut them out of your life. They might be family members. They might be people you work with, your bosses, stuff like that. And they're like, one of the main things I run into is when they mix up type 1 diabetes with type 2, right? And it's like, no other way of saying it. They're absolutely clueless to what we have to deal with, and they sit there trying to be, the Google doctor. That's what I call them, Google doctors. Right? So, I don't know, it's a question probably relevant for everyone.
Yep. Thank you. I feel, first off, thanks for helping us. Just for me, your kind of that experience that you had with an amazing person like Gabor Mate, to be able to know that your story is your story and your emotions are your emotions. And so, really that there is that kind of, I love that idea of not comparing ourselves, because a distressing event, if it's distressing to you, it doesn't really matter if, someone else would call it distressing or not. And so that the awareness that you have in yourself on that it was hard and what to do about it. So first off for that, I've noticed I wasn't really paying attention to these chats, so I'm going to have to go back and look at them. The type 2, type 1 question, sometimes I find myself kind of picking when and if I'm going to go there, because of course we're going to get passionate about it, because we're like, no, these are different. So I kind of have my 5-minute answer that I will give someone if they're going to be willing to listen to me for 5 minutes. I got the 10-second answer that I have for kind of, giving the brief overview of type 1 versus type 2. But whenever it happens to me, I kind of feel this sense of like pride. It kind of helps me be like, I know so much, we all know so much about type 1 diabetes, and we are the expert of this. So when someone else is making me feel like I'm not the expert, then I feel like I kind of have a choice on, am I going to go see this person again for support, or am I not? And I feel like that kind of ownership for how much patience I'm willing to give to a given interaction. I think that, that we have the right to kind of, sometimes if you're in a small area and you don't have a lot of access to supports, sometimes I walk out of frustrating interactions, and I just have to really honor that made me frustrated, and I don't ignore that. I just pay attention to it.
Okay, we're going to go to the next question from Nadia. How to maintain resilience and deal with the judgment around having type 1 diabetes while still sharing your story so others can help you if you need it.
So if Nadia's comfortable asking, I was wondering if she had an example of like when someone kind of made her feel judged by it, because I was wondering if it had to do with like I feel judged sometimes by just I think kind of a medical model's approach to things around, if you don't do this, there's all these complications, and there feels like there's just so much fear. Well, and that was mostly my perception when I was a kid, just the fear tactics that I was scared, looking at all the posters in a clinic and that type of thing. But I think now I kind of feel judgment when people don't understand. And I also feel judged when people assume some things. And so I think I've gotten really good at, because I'm so open about talking how I'm feeling about things, I'll stop someone and say, I don't think you're understanding kind of, this is how I see it. This conversation is making me feel, and I own it. So I think, or I'll follow up. I'll follow up with someone, like doctors, if a comment was made and it's sticking with me. So I think it's knowing that I'm feeling judged and what am I going to do about it. But I'd love to hear if you're comfortable kind of giving me an example. And if not, that's okay too.
Okay, Nadia, one last chance. Okay.
Would you be able to just read the last part of that question? I just want to make sure that I...
Okay. I'll just read the whole one.
Okay.
How do you maintain resilience and deal with the judgment around having type 1 diabetes while still sharing your story so others can help you if you beat it?
Yeah, I think I, again, kind of pick battles there. If it's someone that I'm going to be having a lot of interactions with, then I'll put that time and energy into helping them understand how their words, actions have made me feel, kind of like a conflict resolution type thing. I feel this when you, and then moving forward I kind of fill in those blanks. And then if it's not a person that I'm going to be talking to a lot, then I do more kind of my own work on it, to try to, it's almost like a coal. Sometimes I feel like I used to have this coal that was in my hand, and I'd constantly be walking around, and I was angry that people were judging me, or they were angry that they were misunderstanding me. And just the relief and ease I think I found when I just let go of the coal. Like, I'm the one holding on to it, and and not to say that you are, but I'm just telling you my experience of feeling judged and angry. And then when I let go of that coal, things tend to, I let things kind of bounce off me a little bit more. I hope that answers your question.
Okay, the next question is from Anonymous. Does the research indicate a higher rate of depression in people with type 1? If so, what might be the reasons and strategies to deal with it?
Yeah, so it's a really complex relationship, I feel, with anxiety and depression. The numbers shift, but kind of there's this general consensus that people with type 1 are 2 times as likely to experience depression and anxiety. So because it's so complex, I think, depression it's worrisome, because depression can impact directly our blood sugars, kind of on a physiological level, and then indirectly on how we care about it. And so the research that, I've been focusing on that relates to depression is that self-compassion piece, and being able to be mindful of the critic that we often have in our head, and how inserting those elements of knowing that we're not alone in this, and saying things to ourselves like, no wonder I'm feeling overwhelmed because. I think so often we don't say those types of things to ourselves, and it's been shown to have a direct impact on depressive symptoms. I'll read this quickly. It's a summary for an article on depression. Self-compassion is a way to tap into the brain structures that are responsible for self-soothing and calming. Therefore, by decreasing kind of that self-criticism, we can increase our mood and make self-care less burdensome. So that self-compassion piece that we've been talking about a lot tonight, it's been shown to reduce depressive symptoms. It's been shown to reduce kind of our stress, or kind of our lens that we have towards not just diabetes, anything, and that compliance and care has increased as a result of that. All of these things, mindfulness, self-compassion, it's almost like it's a skill. Like it's not something that you just start doing, but it's something that with practice, like any skill, it gets better, and then those results, can be achieved. That depression symptoms can drop, and so can the impact on our our ability to manage all this.
Okay. The person who submitted that question, would you like to unmute and follow up? Okay, the next question is from Jacob. What routines do you enjoy?
Routines for me are, I have 2 kids at home, so I feel like I'm constantly in the routine of picking up Lego and things off the floor. But to be honest, I think a lot of the routines I have are what we've been talking about tonight. I have noticed that my blood sugars are lower, and I can like manage a low when I set aside time to just focus on nothing but my breath and just do some deep breathing for a minute. So I do that every day, probably about 10 to 15 times over the course of a day. I constantly try to just do that heart math stuff where I try to get out of all these thinking things that are going on, and I try to sit with some joyful moment or some memory that I have, whether it's 5 minutes ago or, years ago, that brings me joy. And I try to just notice what I'm feeling when I'm thinking about that. So I do that on a daily basis. I get out and do a lot of activities. I feel like that's like the most enjoyable way for me to manage diabetes, is going out for a walk and just being outside. So I do that because it all comes back to diabetes. I think everything I do, we all know it, it's like a full-time job. So I wouldn't be talking about these things tonight if I wasn't doing them every day and finding that they were working. So I think that because diabetes is so hard, I'm getting good at saying no to things. And so the routine of just trying to keep things as simple as possible. That's not easy to do, and I don't think friends would listen to this and think that I was keeping things simple, but in my own mind, just giving diabetes the credit that it deserves and all that I put into it. I think I have to remind myself that on a daily basis too.
Okay, Jacob, if you're here, if you'd like to unmute and follow up. Okay. I have another question that was written in. How can having diabetes, how can you turn that into a positive thing?
Well, I think I don't think when I was 20, I don't think sort of before that EMDR experience, before all this kind of work with my emotions, I never thought that would be possible. But I think that when you sit with kind of what's going on for you, I think it's I don't know, it's hard to explain. I've gotten there personally because I have I think sat with the sadness so long, and I felt like I couldn't keep doing that because that coal was just burning my hands so much. So, not to say that it's like a choice, because I don't think it is. I think it's happened kind of, I've let go of the things in my body that were making it hard to have that thought. And all of that was just the emotional stuff. So, sorry, that's not a very good answer, but I think also the self-compassion piece, I think this is when you talk to yourself in a really kind way about diabetes and you recognize, I would say, it sounds like I talk to myself a lot. I'm realizing that that's what this sounds like. But all day long, when I see a high blood sugar or anything, if I'm having a hard time with anything, I'm constantly saying those kind things to myself. And I think over time, you start believing it, and you believe it so much that you almost see your strengths, and you see how much you're doing, and kind of the superhero level of what we're all managing. So yeah, I think I get emotional on things, so thanks for making me reflect on that.
Okay. We have another comment on the board. Okay. Do you have ideas on what can be changed when it comes to policy on mandating counseling and mental health support for T1Ds? What is the best approach, in your opinion, to advocate for this?
Oh, good question. I would, if it's advocating for, I guess it's using those, like, the hot words that that I think if you were having to write for policy or, you know, for support with counseling, then kind of looking at words like depression, like looking at words like I have anxiety around being low, because maybe the kind of description that I'm having a hard time with diabetes, I think that's, you know, that would be an easy in for counseling, but I can understand how that might not be working for some people. And so I would, yeah, I don't know, Patricia, if you have other ideas there. I feel that advocating for some of the results of what's happening, and that, you know, how your ability to manage this is being impacted, and kind of the amount of times you're having to kind of see other care providers because you're having such a hard time with it. Those are just guesses.
So I'll just weigh in. Coming from kind of the academic perspective, the only way I think you can move policy is to produce evidence that mental health leads to lower diabetes and stress, which leads to lower costs for the government in the long term, and it's going to prevent heart attacks, amputations, all those things. So there's short-term, immediate term, and long-term things. I do want to tell you that some of you probably participated in the survey, but a year ago, we conducted a survey with people with type 1, and we had them complete the diabetes distress scale and just other kind of demographic things that we always ask. And, you know, my thought was, I just wanted to know kind of what does the distress landscape look like for type 1s in British Columbia? And so as we were analyzing the data, we did these, you know, statistical regressions, those kind of fancy things. And what we found was that people who had extended healthcare had lower management and physician distress. And that relationship was significant at a P less than 0.05. And that's the magic number that people look for, scientists, healthcare policy. And so we actually wrote a paper and we submitted it. And so what I'm hoping is it gets published, and then I send that paper to Adrian Dix and say, hey, look, we already know from lots of research that diabetes distress is linked closely to glycemic control. And in fact, it's more closely related than depression. So we really need to look at diabetes distress, but not only is it related to glycemic control, it's related to high blood pressure, high cholesterol. And there just was a study that showed progressively that it was associated with a 1.8 times higher mortality rate in cardiac mortality. So this is all the evidence that's coming into light, and we collect that all. And then again, what I've been asked is, well, how do you know that people in BC, type 1s in BC, are distressed? Yeah, maybe this data is coming from the United States. And so our study is showing that, yeah, folks in BC are distressed, and the people who are distressed only have provincial health care. So that would be my answer. One of the ways I think that policy folks are going to pay attention. Okay, so I know that Lauren could stay until 7:30. If you have another question, go ahead and type it in the chat box. Okay, so while we're waiting for the next question, I did want to say, the person who had said, you know, how can you turn diabetes, how can diabetes into something positive? Again, I work with a lot of people with type 1, and there was this one time we did a focus group or a think tank, and I played this little game of what ordinary thing do you do extraordinarily well? And it's a game I play with, my medical students, my research assistants. I've done this, I don't know, probably 50 times. And each time I do it, the answers are different. Someone says, oh, making blueberry pancakes. Oh, it's reading a map. And so I was in a room with 17 people, type 1, and I asked this question, and I collect all the answers, and 11 of the answers were making schedules and being organized. And I just thought that was fascinating, because I've done this so many times, no one ever had the same answer. And what I thought was, when you have type 1, you don't have a choice. You become type A. You might, all of you are so unique and different in your personalities and your temperament, but when you have diabetes, you almost have to become a certain kind of person. Is being type A better? I think, being organized, being able to make schedules and do things on time, most people are it's better. But the other thing I think is that by having type 1, you have compassion for other people. So some of you might not feel that you have compassion for yourself yet, but you certainly have it for other people. I do have, I've talked about this before, I have a neurological condition that's very rare, and it's not caused by anything. And so when I was in Kelowna, I went to some vineyard, and a woman who was helping us had, basically you can't talk. You're talking and people can't hear you. And I knew, I was like, that's spasmodic dysphoria. And so I just pulled her aside and I said, can I ask you a question? Do you have a spasmodic dysphoria? And she just started crying, because it's like 1 in 50,000 people have this disease. And she just felt like she had never met another person with this condition. And the thing is, like, when I look at people, I'm empathic. I feel differently. And so I know all of you, before you had diabetes, or because you have diabetes, you look at people in a different way. You cut them slack, so you should cut yourself slack. If you're cutting everyone else some slack, why can't you cut yourself some slack, right? All right, so I got another question. All right, what is your, you know what, I'm gonna ask the Marina's question, because I know Kent has already. How do you balance being kind to yourself and at the same time not lose strength to resist all the burdens of type 1?
Can you read that again for me?
It says how.
You can say it out loud.
Yeah, Marina, go ahead.
Yeah. Hello, that's me. So when you are kind to yourself and allow yourself to be weak, and all the burden is like, it's so difficult for us to handle the diabetes, you kind of switch into that mood that, like, okay, I'm weak and I'm allowed to not handle it properly. And when the opposite happens, you kind of like, no, I'm not allowing myself to be kind, so I will be strong, and then you like go forward and resist. So how to keep that balance in a healthy way? Thank you.
My gut reaction would just to be like, if you have those two abilities, or you have those two kind of reactions, like, to trust that your body probably needs one of those in any given moment. And if your body or your is saying, I need to just be resilient right now and kind of get on and go, then to trust that that's probably what you need in that moment. And so I think the balance for me is just I don't try to balance things out. I just try to pay attention to what I need in the moment. And so that sometimes I need to just be sad, and to notice that I'm feeling sad, and to not judge it as good or bad. It's just, I'm sad, period. And then sometimes to be like, okay, I feel like I have too much on my plate right now, and I need to kind of just, I can't deal with this right now. And to know that that's, no wonder I feel like I can't deal with it, because I have so many other things. Diabetes isn't my everything. diabetes is a part of my things. And so to kind of, honor that, if I had only diabetes to be worried about, things would probably be pretty easy, but we got a lot more other things on our plate too. So I think, I don't know, no balance, just doing what is that answered?
Yes, thank you.
Haley, did you have a question? Yeah, Haley, did you have a question or just a comment?
It was just a comment.
Okay.
Yeah,
Right.
responding to Winnie's comment.
Okay. If anyone else has a question, go ahead and put in the chat box, and then I can just call out your name, just because there's 2 pages of pictures. Okay. So Megan, go ahead and ask your question.
So is that me?
Go ahead and ask the question.
Awesome.
Thank
Hey, Lauren. I was earlier asking about the policy change, and thank you for your reply. I know there's a lot of work to be done, and it's definitely evidence-based, so not really sure how to go about it, but one step at a time. I guess my question is around if you sort of have perfectionistic tendencies, even before the type 1 diagnosis, and in your mind you're constantly on that number and it becomes a goal that you have to hit every time, it kind of, you can sort of develop that self-loathing aspect to your personality, and it can be hard to break out of, and that can make you less productive. So I guess, how do you get out of that cycle? What is that internal narrative, that story that you tell yourself to be like, you gotta let that go?
So I would ask, like, that perfectionist piece, like, why are they working so hard? What are they trying to achieve with that kind of needing to be right all the time? Like, what would it take for that part of you to not care as much, or to kind of sit with when I've talked to my perfectionist side and like feeling like I had to have those perfect numbers, I've also just I felt that once that perfectionist felt heard and understood, that they weren't crying for my help all the time. So again, it goes back to, like, I've sat with it and kind of like had a conversation with them to kind of understand, why are you working so hard? What do you care about? What am I not understanding? And by understanding and kind of validating why that part of you is there, that it's not good or bad, it's there, and that sometimes when they feel heard, that they shout less.
Definitely easier to do when you're talking to somebody, like with a friend, but much harder to do when it's just you and your thoughts.
Yeah, I would agree. Yeah, I would agree. And so sometimes this idea of like having to talk about it is also like, sometimes people like to write it, and kind of writing to those, because sometimes that's a bit easier, but again, it has to feel like it's something that you're comfortable doing.
Thank you.
Thanks.
Okay, any other questions? I did want to comment that Ian had mentioned, you wish that you guys individually could also share your stories, just like Lauren did, and that's a great idea. If you have ideas of how you want other future sessions to go, please just email me or Soraya, because we build these sessions around you. So for July, for 30 minutes of the session, we have Grady Mealy, who is probably the most well-known diabetologist in Canada, and he specializes in type 1 in the elderly, and we have at least, I think, 6 or 8 of you here who are over 60, and so for that segment of 30 minutes, we brought Mealy in, and so maybe for the next 45 minutes or hour, we can do the sharing stories piece, and Soraya and my team can organize things where you say ahead of time, I want to be someone who shares that story, and so that way it can be a little bit organized, not chaotic. But again, I want to thank everyone. Lauren, do you have any parting words before I kind of wrap it up?
I'm really grateful to kind of get to see some of you and just hear some of your questions, and just appreciate an opportunity to, again, keep this conversation going. I feel like I feel heard and understood when I get to know that other people are kind of in this with me a little bit. And so I'm just, grateful for this huddle, for this community, and look forward to more conversations with all of you.
Okay, great. My last comment, parting comment, is again about the what's positive about having type 1. I know some of you here by face, but I don't know all of you. But what I can predict, without even meeting you, is that your emotional quotient is high. It's higher than the average person, and that's something that is really positive, and people look for. So that's one other thing you can thank, because you have experienced so many difficulties. All right, so again, next month we're going to have for 30 minutes someone who specializes in, actually it's elderly and long-term complications. So if you have questions about long-term complications, it is definitely a session for you. And let's try to see if we can work in having other people share their stories. We'll kind of communicate through email. So thank you and good night.